All right, hey, once again, it's me. I'm Kevin Ellis, local president at 2338 in Poplar Bluff at the John J. Pershing VA Medical Center. With me today is an employee that unfortunately has suffered another workplace injury and has been mistreated by the agency. This is another case of disability discrimination that we're going to talk about. You've heard me mention a couple times on videos about a chance employer versus a choice employer, and how a choice employer would take care of their people. People would love to come to work for them. It's a great place to work, and people are knocking on the doors to get in. A chance employer is one who do not take care of their employees, and they make them fight just to stay alive and to feed their families. So today you're going to hear a story about a young lady that still has an ongoing workplace issue as we speak today. Okay? So without any further ado, I'm going to turn the camera and we're going to jump right into it. Okay. All right. Tell us who you are to begin with.
My name is Kristy and I am a dental hygienist.
Okay. And how long have you been with the John J. Pershing VA Medical Center?
I started in April of 2018.
18?
Yeah.
So you've been with us now about 7 years?
Yep.
Okay. How long have you been a hygienist?
Since 2009.
Okay. Have you worked locally in the community?
Yes.
Are you from Poplar Bluff area?
Yes.
Okay. And what brought you to the VA?
Because I didn't have health insurance through where I was before.
Mm-hmm.
I had a 401k, but I didn't have that, and I was a single parent, and I needed help. So.
Okay. All right. Tell us about some of your hygiene duties. What were your responsibilities working here?
I actually saw the patients and cleaned their teeth, did a lot of perio exams,
Mhm.
all kind, normal dental stuff. We stayed busy a lot, except for when COVID hit. When COVID hit, nobody was seeing anybody for a while. And then
Okay.
they slowly started gradually giving us more and more patients.
Okay.
Yeah.
When did you first get injured?
I started noticing in the beginning of January of 2021 that I was having a lot of muscle weakness and my hair was falling out, and I had COVID, and they vaccinated me. Ashley Leopold is the one that told me it was safe. She said if I wasn't running a fever, it was okay. So they vaccinated me, I think it was like 16 days after I got released from having COVID.
Okay.
And COVID, when I had COVID, I had a bad infection. Was running 103.5 fever.
Mm-hmm.
I was really sick. I wasn't put in the hospital because that's whenever they said if you're not dying, don't go.
Right. Right.
So
I remember.
yeah. So, and then after that happened, I think January 14th was the first time I went to the doctor complaining of symptoms.
Okay. So let's make sure I hear you correctly. You caught COVID,
Yes.
as a lot of people did.
Yes.
You became ill.
Yes.
And then about 2 weeks after coming back to work, they made you take the vaccine.
Yes. So what happened is I had left the dental clinic to use the bathroom, and as I was walking by, Ashley said they had an extra vaccine dose. She said, would you be willing to take it? Because that was whenever they weren't wasting any doses. They didn't want to throw any medicine out.
Right.
So I walked down and I said, I need to talk to my supervisor, which was Dr. Hamlin. And at that point, he said, if you don't take it now, they're going to make you take it next week.
Okay.
So I took it.
Okay. Did they explain to you about the waiting period between when you had COVID versus when you could take the shot?
No, nothing. The only conversation with me was as long as I wasn't running a fever, I was good.
So nobody explained to you that after contracting COVID, you have to wait about 90 days before you could take the vaccine?
Nope.
Nobody told you that?
Nope. The only person that had something to say about it was my mother. And
Okay.
she's like, I'm really concerned. I think it's a little too soon. But, I didn't know any better.
Mm-hmm. Okay. And do you recall what Ashley LaPoe's job description was here?
She was the chief. Was she chief safety officer or?
Mm-hmm.
That's what I thought.
I think she was the environmental care
Yes.
and the agency safety officer.
Yes.
Okay. One would have thought that the safety officer and the RN would have known there was a waiting period
You would think.
before you could take the COVID shot.
You would think.
We knew that as employees. We knew it from that basic information that was being put out.
You know, this
That there was a
happened.
90-day wait period between if you caught COVID and when you could take the vaccine, because a lot of elderly people had contracted COVID and could not take the vaccine until the waiting period had ended. So I'm shocked
Nobody
that
said anything.
nobody warned you about that.
Nope. And I did. I even asked her. I said I had a pretty severe COVID infection. I said a couple weeks ago. I said I got released back to work. I can't remember the exact date,
Mm-hmm.
but you know, it was the 14 days. I was out for 14 days with it. I think the first vaccine was December 23rd that I had,
Okay.
which, like I said, it was like 16 days after I had COVID.
Okay. During the time period that you were out, were you required to use your own annual leave or sick leave, or do you recall?
I think at that point they were covering sick leave.
Okay.
Because I mean, a lot of people were having like reactions and sick the day
Mhm.
after, so they were giving leave at that point for the vaccine.
Okay. The reason I'm asking you that is because we're going to sign a settlement agreement with the agency next week to give back hundreds of employees who were required to use their annual leave, sick leave, or were required to, or was given AWOL because of that time period. Everybody didn't get the free leave as they should have.
Right.
That's why I was asking if you.
Well, they
if you
shut that
recall.
down. I remember whenever they stopped that, and I think I was in the first round of employees that
Mhm.
got vaccines.
Okay.
So
Just for future knowledge, it wasn't shut down until 2023 when the pandemic was deemed over. However, the contract still required that if employees are sent home, they're required to give them weather and safety leave.
right.
Just so you know that.
Okay.
So even though some of the programs that ended about the free leave, all of them did not end. And the contract never ended. It's still in place. Okay? Now, let's go back to you taking the vaccine. You took the vaccine, you got sick. What happened next?
So, like I said, I started having days where I was having muscle weakness. It wasn't all the time, but like I tried to go to the gym because I was running. I was a runner, and
Mhm.
my legs were just too weak, and I was trying to figure out what was wrong with me.
Okay.
And that's whenever I finally went to the doctor, and they drew labs and everything, which I have, and everything was still pretty good at that point. And then whenever I had the second vaccine, which was, I believe, January 21st of 2021, I had a reaction, adverse reaction. And within seconds, it felt like my throat was going to close. And I was, you know, it was just bad. But they noticed because they sit and watch you right after you have it.
Mm-hmm.
So one of the nurses came over and took my blood pressure, and it was like 170 over 114. So they took me down to urgent care. They gave me Benadryl
Mhm.
immediately. They took me down there. They did an EKG and started fluids on me and kept me there until they got my blood pressure down. I mean, it wasn't down all the way. It was still a little elevated, but
Mhm.
then Jason came and picked me up.
And who's Jason?
He's the one. He's a saint. That's what he is.
Are you the husband?
I'm a fiance.
The fiance?
Yes.
Close to being a husband.
We actually got engaged right before she got sick,
Okay.
and so
And this is what
Had
we've
you
been
already
dealing
planned
with.
your wedding? You during that time period when you can get married?
well,
We
yeah, that was the idea. You know, you find somebody, you fall in love, you want to be part of their life,
Mm-hmm.
and you wake up the next day and it's all changed. It's all different, and it's a whole different fight. And instead of planning for a future, your role changes to
Mm.
be supportive, and
Yeah.
you just have to kind of help her get up every day. You know, it's just a whole new rule, and I'm not going anywhere.
Good.
You know, I get to see it every day,
Okay.
and I get to hear it every day, and so this is a wonderful idea. The union, without the union, I don't think she would have gotten this far. The support.
This agency has a issue with supporting employees that have workplace injuries. Scotty White, as you recall, suffered a workplace injury. He went 4.5 years, without getting a paycheck. Have you missed getting any of your paycheck?
Well, I am now because
Hold on, what do you mean, I am now?
the agency started marking me AWOL. It's been 2 weeks already since they started in. And what they did was they sent me to one of their doctors, which was a referee doctor. And I don't know if they didn't give him all my records or whatever, or if it was, I don't know what happened. But he
Okay.
said it was okay for me to return to full duty. So they took that over Christmas time while Scotty was out and while my attorney was out. And gave me like a week or whatever to sign this paper, and I didn't sign it, and I didn't return to duty like they told me because it would have hurt me. You know, I'm not well enough to be put in that situation. So now I am not getting a paycheck.
Don't you have a workers' comp case?
I have two. I have
Okay.
3.
Tell me about your workers' comp cases.
What happened?
Yes.
Okay, so the first time I filed for the vaccine and I filed for COVID both because they're saying, I don't know if it's the same symptoms between long COVID and what vaccine.
Mhm.
They don't, people don't know yet.
Right.
Honestly.
It was early.
Yeah. So, the first lady, her name was Kimberly M. That's all I know.
Okay.
She would not approve of any of my stuff. So the first appeal that Scotty did on my case, another lady got
Okay,
it.
wait a minute. You said they wouldn't approve your first COVID workers' compensation claim.
No, she wouldn't. Even though she had all the documentation saying that I was in the long COVID clinic and saying that I was in research at WashU, she ignored all of it.
Even though she knew they made you take the vaccine at work and you had a reaction to the vaccine at work, workers' comp still denied your claim.
Yes, and to be honest, I don't think that Edwina Dickerson even uploaded what happened to me here at the facility until it was at least a year and a half later.
Are you kidding me?
I'm not kidding. Because I wrote a letter to her saying, you know, like maybe if you would have uploaded what happened to me at the facility, maybe they wouldn't have treated me this way. They would have known that this happened.
So you know that when they deny your workers' comp claim, they are denying you medical care.
Correct. So I appealed
Okay.
it. Scotty didn't appeal, and it went to another claims examiner. And she approved me immediately. She's like, I don't know why this wasn't approved. I don't know why you didn't get help. She's like, there's plenty of information here. Well, after that, once she appealed everything, they turned around and gave my case right back to the same lady to help me.
You kidding me?
No. So I went back to this Kimberly M, and the first time she sent me to a SACOP doctor in St. Louis. His name was Stephen Brown. She sent, like, I have the specifics in there,
Mhm.
but like 80 pages out of like 600 medical records. And most of them were forms to return me back to duty, you know, just stuff that he needed to fill out. And he did make a comment about that. Well, then...
Now, what do you mean he made a comment about that?
Well, whenever I got there for the exam, Jason took me.
Mhm.
I brought my laptop to show him my x-rays. I had like a briefcase, like this thick,
Mhm.
full of medical records. And he called QTC, and QTC would not allow him to look at my records. He was only allowed to make decisions off of what was provided by Department of Labor.
Okay.
So that's how I knew that
Yeah.
something was a little fishy. And I came back and I, you know, like, this whole time I fought and fought and fought, trying to figure out how to get help. Well, I filed a congressional because I couldn't get any help
Okay.
at Josh Hawley's office.
Mm-hmm.
So then they came in and they went to one of the branch managers or whatever, and
Did you get a response back from Josh Hawley?
I did.
And what was the response?
Well, it was just uploaded the letter that I wrote into my case, and then made them look through it, and then they found out, and it's in the letter, the congressional response, that I was not provided due process. So then they sent more records the second time to the same doctor, and then he said that some mental stuff. He was like, something, I had prior mental. And here's another thing that happened on the statement of accepted facts. Like, they kind of, they were trying to blame everything on mental, like I was crazy.
You kidding me?
No, I'm serious. They said I had pre-existing ADHD, or I did have ADHD, or ADD, but pre-existing, I'd have to look it up. I don't know exactly, but it was the stuff that my psychiatrist was trying to get approved as conditions.
Mm-hmm.
They turned around and they took his letter and then put it in that saying it was pre-existing.
So the agency and DOL took a condition that had nothing to do with the vaccine and tried to use that to submarine your claim.
Yes, that I was crazy. So then Dr. Brown, like in his report, that I had mental something prior, and it was hard to get a good, accurate blah, blah, blah. I don't remember all the wording, but something to that extent.
You're kidding me?
No. And then they turned around for my vaccine case and sent me to the same doctor. For a whole different case, sent me to Dr. Brown again.
And right now, they're not paying you.
Nothing.
So you have a approved workers' comp claim moving forward right now.
Yes.
Do you also have a reasonable accommodation?
Yes.
And what is your reasonable accommodation?
Well, they didn't give me one.
Wait a minute. Where have you been working at for the past several months?
Oh, I have been working at home, just doing like computer stuff, like through medical records.
Mm-hmm.
Tuesdays and Thursdays, I was working from 8 to 1 at home.
Okay.
And I was doing really well with that, because before, whenever they weren't giving me, I was working all the time, I was having crashes because of chronic fatigue.
Okay.
So even with that job being on light duty, I still go to bed right after I get off work. They don't understand it because I don't look like something's wrong with me.
Mm-hmm.
They assume there's nothing wrong with me.
Okay. Now, the reasonable accommodation. You were working for Tina Thomas. Do you realize that she said she gave you them duties because of a reasonable accommodation? Were you aware of that?
No.
The way the reasonable accommodation process works is when you make a request for reasonable accommodation, the Rehabilitation Act of 1973 says it does, the VA, the big VA, not locally, big VA has said, we don't care about an agency or local policy. We don't care about a position description. We don't care about any of that. If the employee has a disability, you are to give them an interim accommodation, which will remain in place until a final determination has been made. Have they given you any reasonable accommodation form stating that you're on an interim accommodation,
No.
your case has been closed, or anything at all?
Nothing.
You have a reasonable accommodation case right now. And that's why it's important for the division director to get this video. They are required by law to go through every form and say, hey, you request a reasonable accommodation, what's happening? Why do you need one? And from that point, they ought to offer you an interim accommodation until everything is completely done. And sometimes that might take a year, 2 years, or 3 years. Because as long as you're in medical treatment and you're being treated by a provider, the reasonable accommodation remains open.
Yeah, they didn't ever provide me an accommodation, and in fact,
On paper.
on paper.
They gave you one unofficially by allowing you to work for Tina Thomas.
Tina wanted me, from what I understand, she said, I like people that, have a lot of medical experience
Uh-huh.
to do like the hem scanning. She's
Right.
like, and I need help. She was really, really good to me. And then
Mhm.
she said, after I was there for did a couple weeks, she's like, I don't know why they're not allowing you to work at home like everybody else is.
Right.
So then she got me to where I could work at home. She said
Correct.
it wasn't making any sense.
I remember that.
Yeah.
I remember that. Do you have any emails about those conversations?
No, because they were mostly just between me and her,
Okay.
in the hallway or.
Okay. Just so you know, I have emails between Tina, Scotty, and her about you being given a reasonable accommodation. And she said, we've given her a reasonable accommodation. And she's working from home. Therefore, they should not be asking you to come back to dental office to do anything because you're on a reasonable accommodation.
And, they don't even have an open position for me. They hired someone to take my job. So
Okay.
this was done on purpose.
So let's circle back around. Do you remember having a conversation with the reasonable accommodation coordinator,
Yeah.
Vincent 15? Do you recall what her name was?
Paris Moore Brown.
Okay, and do you recall having one with Moore Brown's supervisor, LaWanda Newton?
Oh, yeah. Many.
Okay. Do you remember LaWanda Newton telling you to go back into your workplace? Do you recall that conversation? There was a conversation, a meeting with you, Scotty White, LaWanda Newton, and myself
Yeah.
about the reasonable accommodation.
Yes.
Yes.
That was whenever she was not being very nice. She was yelling and I was crying, I believe. Is that
You
the
were?
same time?
Mhm,
Yes.
yeah.
Because I was terrified.
Okay.
Sick, tired, scared. I didn't know.
Do you know she treated Scotty White the same way?
I do.
And do you know she treated Katina Dudley the same way?
I do.
Both of the employees received reasonable accommodations with compensatory damages. Were you aware of that? Okay.
No, I don't. No.
Okay. The Rehabilitation Act requires the agency to give you a reasonable accommodation. And when they violate that law, they have to give you compensation if you have suffered mental, physical, emotional harm.
And I have all of those at their hands. Because they kept me in dental, I want to say, full time with chronic fatigue. I'd come in and I just cried the whole time. I'd see a patient and then I'd go back in my room and I'd bawl my eyes out. I was so sick. I was sweating through my clothes. I have pictures of me sweating through my clothes. And that was after Dr. Bierschen had come in here and they tried to make me go back through the accommodation process.
Okay. So let's talk about that. Dr. Hamlin was aware of the injury.
Yes. He was actually in urgent care with me. He came down with me and was right by the bed while they were taking care of me. He
Okay.
knew. And he is the one that put my accommodation, or put me on light duty because
Okay.
I was so sick.
All right.
And as soon as he left, then it all hell broke
All right.
loose.
So he left, and then who was he acting?
Dr. Dennis.
Dr. Dennis.
Yes.
Okay. And if I recall correctly, she was helping you through the reasonable accommodation process.
Yes, because she knew how much I was suffering.
Okay. And if I recall, she had approved your reasonable accommodation
Yes.
as the deciding management official. She approved it.
Yes.
Okay. And then the agency turned around and says, no, we're going to put your medical condition on hold to wait on a new provider to come in.
Yes.
I mean, a new doctor, your new supervisor.
That didn't
who-
even know me
who
or
didn't even
anything
know
about me. Yep, that's what they did. They waited till he started, and then LaWanda knew. No, he sent me a message saying they wanted to have a meeting and get up to speed on what was going on with my accommodation. And then that's when all that stuff, they tried to tell Dr. Dennis that she illegally did my thing and all that. You remember all that.
I do.
Yeah, they blamed her.
So how do you illegally approve a reasonable accommodation for somebody who has an injury and a disability? How do you do that?
I don't know. Like, she knew. I mean, she knew how sick I was
Now, how did she know?
because she had been in the clinic with me. She saw me prior. I was working 2 jobs, running half marathons. I went through school all while I was doing all this, you know, and she saw me go from here to here. She knew.
Okay.
And she was trying to take care of me because she knew what was going on with me.
Right.
And then they put me under Dr. Bierschen, who comes in. I have no clue who he is. He has no clue about my medical history or my work history.
Correct.
None of that. And tried to start the whole process over again.
You can't restart a process for reasonable accommodations because you weren't here when it began. You realize that when the DMO, Dr. Dennis, had approved your reasonable accommodation, that was the end of it.
It was never.
It should have been completed, over with, and done.
Yeah, and it was like she did all that. That's why she marked like time because she kept emailing saying, you know, this employee's getting hurt more while we wait on you. Like trying to figure out why it wasn't being signed. And that's whenever they came in and tried to say that she did an illegal accommodation, and because she put the word permanent in it.
Well, that's what it is.
Yeah.
It's permanent.
Because I was failing, like, she knew I was failing my patients. Like, that was hard on me mentally, having to call in every day that I was sick. I was sick every day. And that was whenever they were doing COVID test. So my patients were coming in doing a COVID test, and then I coming up and having to go through all that crap, and then I would be sick the next day or something. Like, it was hurting me that I was hurting, my illness was hurting them. And that's why I wanted an accommodation, you know? Like, mentally it was hard on me. I don't want to fail my patients. I love them, you know?
Okay. So right now, as of today, you're not receiving a paycheck from your employer because of a workplace injury you endured here.
Correct.
And they're counting you AWOL.
Yep. And all this was done to me. I didn't do anything. I say that all the time. Like, what did I do wrong? I don't know. Like, I just... I didn't do anything. I don't deserve it. Like, they've taken my job. They've taken my health. Now, mentally, like, I don't even hardly leave my house right now.
Are you seeking counseling?
I'm trying. They're trying to get me into a counselor through WashU right now.
Okay. Okay.
But here's the deal. Like, if they continue to mark me AWOL, I have an immune deficiency now that requires infusions.
Okay. Why do you have that now?
Because of what happened to me. My immune system dysregulated.
So you have an immune deficiency now directly related to the vaccine they required you to take.
COVID and the vaccine. Yep.
Okay.
And the study that I was in, it says it right there on the top. The study is for immune dysregulation following COVID or whatever. I mean, it says it all right there. You know, and I've tried to lay it out. I showed them my labs, how my labs were here, and they just kept going like that. My red blood cell count, my hemoglobin, hematocrit, kept nosediving after. You can see, like, everything was normal in 2019.
Do you realize that Miss Moore Brown and LaWanda Newton and Dickinson are not providers?
They're not?
They don't have a medical background?
No, I know. That's what was making me so angry. Like, she was ignoring... So, like, my occupational therapist, I was doing so bad. Like, I drive to St. Louis to try to do physical therapy and occupational therapy. It was all in the same place. And I was so sick at that point, they had to put me in a private room. I drive up there and I just cry hysterically. And my occupational therapist reached out to Edwina, which Scotty has all these emails.
Okay.
Trying to get me in a different position. The first position they put me in was a red coat. And
Ambassador.
yeah.
Okay.
With chronic fatigue and immune deficiency, they decided it would be smart to put me down in urgent care. that's the first place they put me for an accommodation. Pushing people
Where
in
sick
wheelchairs.
people are coming in.
Yes. And I was immune deficient.
And who made that choice? Who made that decision?
Edwina.
Okay.
But she also ignored the, like, I don't know how many times my occupational therapist contacted her trying to help me get me in a more suitable position. And she didn't answer. She drug it out. It was like 2 months that this was going on. She was trying to get me in another position. And Edwina was saying that, she said somebody, I'm trying to think of the word. It was an advocate for me, but none of my providers. And she couldn't talk to that advocate. That was her excuse. But she knew. I wrote letters saying how sick I was.
And it's been confirmed by the providers that you're seeking treatment from.
Yeah.
How sick you are.
Yeah.
Obviously, you qualified to do many jobs here. Have they not offered you a job as a advanced medical support assistant?
Nothing. They haven't offered me anything.
What grade are you?
GS 9, I think 5 now.
Okay.
And I just finished my bachelor's degree, so I have all these bills. You know, I have to pay for my degree that I'm never going to get to use.
What's your bachelor's in?
Health science.
Okay. Okay.
I mean, unless something changes, like, drastically. Like, right now, I'm still stress causes crashes, you know.
Have you met with Fabian, the
No.
new interim director?
No.
Have you met with James Warren, the associate director?
No.
Okay. We're going to try to set up a meeting this coming week with Fabian as the medical center director.
Okay.
And the visiting director, if he doesn't respond quickly. I think he's out until the 24th, which is I think on a Thursday, Friday maybe. I'll figure it out. But we're going to try to get you a meeting with him immediately.
Okay.
Because there's no reason they should be counting you AWOL.
No, and that's what my attorney said, too. She's like, I don't know, there's no reason that she has a workplace injury. Why would you be counting her AWOL?
Not only a workplace injury, but you also have a reasonable accommodation.
Yeah, and she said that, and the last statement she said is, once I get this appealed and it's approved, your agency's going to have to go back and pay her.
That is correct.
They're going to have to remove all that.
That is
and
correct.
So OWCP can pay her.
That is
But
correct.
my fear right now is I'm on tons of medication. Like, are they going to remove my health insurance? Like, I don't know.
Okay.
I'm scared.
Okay. If you have the opportunity to speak to the visiting director, Patricia Hall, what would you say to her right now?
It's really sad that this is how employees are treated. Like, I was so excited to get on here and so proud to take care of the veterans. You know, like, I was. Like, I loved my patients. And I got all kinds of different eye care awards for how good I was with my patients.
Okay.
You know, and I'm just devastated over it all. Like, I didn't ask for this. Like, I've been picked to death on top of being sick for 4 years.
If I recall correctly, you've been trying to do this on your own until you contacted the union.
Yes.
How long had you been trying to do it by yourself?
A whole year.
Did no one offer you union help?
No.
When you began your workplace injury or your reasonable accommodation?
No, they never even submitted to VAERS that I had an allergic reaction. And that's like, they have to. They didn't. I'm the one that had to submit it.
Okay.
I mean, that's another thing right there.
How is this impacting your children?
Well, my kid graduated high school and I was too sick to go on the vacation with everybody and my family. I miss my nephew's doctorate graduation in Florida. I miss family vacations. Like, I haven't been anywhere. I don't have any money.
Or good health?
Yeah.
Because of the workplace issue?
Yes.
What toll is this taking on you?
Well, you would think that the Veterans Administration would find the most competent people because of who they're caring for. And Kristy was one of those competent people. She loved going to work. She would come home and talk about her patients. And I was able to see all the eye cares that came in. And to think on when she got sick, how the agency seemed to work harder at denying her, working harder at covering up her illness, working harder at hurting her, working harder at twisting her words and not adding truth to her file, especially when you would send someone 4 hours away to meet with the doctor. It wasn't even his office, some satellite office.
In a bad area, bad neighborhood. It was a chiropractor center.
To go there, to talk with this doctor who hadn't seen one medical report on you at all. And you know what he does? He sits and talks, asks a couple questions, took her for a walk around the block, and said goodbye. She had to drive all the way home, 4.5 hours for the doctor to say, I don't have any information. Her heart rate seemed fine when I talked to her, blood pressure, she might seem fine, I don't know. Now this is an agency that she's asking for help from. So I have to sit there and I have to watch her fight every day to get up and fight every day to go to sleep because she felt so alone on how can this company and these employees, what did I do to them for them not to look at adequate documentation from my own doctors, my own primary care doctors that are saying, this is what's happened to me. And I'm asking you just to give me some reasonable accommodations until I feel better enough to come back. I'm still working at a strong capacity here at the VA. My working managers love the work that I do. I'm always on time. I'm never late. I never take off work. I work sick. I do all these things for you, but all the energy that you're using is negative towards me. And I just asking for help. If you would have just asked me for help from the get-go, I wouldn't have to be sitting here 4 years later with missing great family accomplishments. She's a single mother, has a daughter who just graduated from medical school or nursing school.
Yeah.
Right? How amazing is that for a mother to raise her on her own with her family, of course, and then for her daughter to get her first job in St. Louis by herself, where her mother just wasn't able to, she's there, but she's not there. Right? As the human element is that when we're engaged with something, we want to be all in. We don't need to be aggravated by other people making life that much more difficult.
Like they would.
So they showed you no sympathy, no compassion,
Zero.
no caring from the workplace injury that you have had to endure.
Correct. And Dr. Brown even went as far, I have documentation where he called WashU and spoke with one of my immunologists up there. Yet in his report, he said, because I have mast cell activation syndrome.
Mm-hmm.
It's part of this COVID stuff.
Mm-hmm.
And makes you allergic to a lot of things.
Mm-hmm.
He said it was a malingering condition in my report.
Really?
I'm a malingerer. After he talked to the doctor that's treating me for that. I mean, I'm pretty sure she wouldn't have told him that she wouldn't give me medicine for something make believe in malingering.
Correct.
So I mean, I've been made out to be this crazy person. Like I'm just trying to get something for nothing. I just want to be left alone so I can have some kind of life.
Do you realize one of the tactics of the agency is to discredit you?
Beat you down.
Mm-hmm.
And Dr. Biershin, the new guy that came in, he was sending me letters saying by such and such date, emails, that he was returning me back to full duty. So I'm sick like this, and I'm getting messages from Dr. Bierschen, who is my supervisor now, threatening me.
Okay.
While I was in the clinic. Then he tried to get me to say I wasn't fit for duty so he could fire me, which you guys know that too. That's all on recording.
Correct.
It's awful. I'm terrified to even come in this building.
You know, there is a No Fear Act. And for you to say you're fearful to come into the building.
I am. I get upset, don't I, babe? I cry.
It's hard not to when the people that you're engaging with to help you
Are hurting you.
are smiling at you while they are knowing that they're in cahoots with whomever else is supposed to be hurting, and then they create a whole interpretation of their own.
And
Since they don't have any medical history, as you mentioned, no background, who are these employees? Who hired them? And why are they even in a position to assist those who do have workplace injuries?
You know, that's what I did make that known to Edwina, that she doesn't have any medical anything. She has no business making any decision on somebody that has an illness that people don't even know yet is, you know? Like, I've struggled with my doctors for that whole first year. Nobody knew what long COVID was or anything about what the vaccine caused. So on top of being beat down by all these people, I'm being, you know, I think in the beginning they blamed all my illnesses as psychosomatic. I was making up, you know, I had to fight the doctors until I finally made it up into the long COVID clinic. So they were calling me a liar too on top of it.
Okay.
And that's what the agency, they take every little old record from in the beginning when the doctors didn't know what was going on, and they've used them all against me.
As if you're not sick.
Yeah.
And as if you did not suffer a workplace injury.
Correct. Yeah, they took every negative, something where one of the doctors would be questioning what was going on with me in the beginning. They take every little negative thing, and, you know, that's what caused it. You know, they don't look at all the other records that come from WashU saying that I've been in research in the long COVID clinic for 3 years.
Right.
You know,
Right.
it's just,
Are you still in treatment now?
yes.
Do you know how much longer you're going to be in treatment in that study? You have
I'm
any
done
idea?
with that study right
Okay.
now, but I just had an appointment with infectious disease last Monday, and they're trying to get me in a post-exertional malaise study for chronic fatigue, which they're fixing to do. And right now what they do, I see them every 6 months, and they just kind of track me right now until new stuff comes out,
Okay.
like new trials and
Okay.
all that stuff.
So you're still receiving treatment even as we sit here and talk right now?
Yes, lots of it.
Okay.
I'm on I don't know how many medications right now. And they upped my co-pays too. This is what's sad. It's like when you get somewhere, it's like you get kicked when you're down, you know? Like, they upped my co-pay on my medicine to $500.
You kidding me?
No. Beginning of this year. And they would not release it until I told them that I was going to pay that up front. And I said, I don't have that money right now. I said, I don't have any money. So finally, they got me into a patient support thing where they're covering my co-pays. But I mean, that's the kind of crap that I'm dealing with.
I didn't know that.
Yeah. I pay $300. I was paying $300 every 3 months, and now $500, and they upped all the rest of my medication too.
Because of a workplace injury, you're having to pay that out of pocket.
I paid every bit of it. They have not paid for one thing. Even they hired a field nurse to take care of me, to help me, and the field nurse kept telling Kimberly, whoever that is, that I needed this, that, this. She needs to be seen by every specialty, because I did. You know, it's like a full, everything gets messed up. And she ended up getting into it with her too. Like, she said that it was my job to prove I had a workplace injury. And until I proved it, they weren't going to send me here or there. So they hired this nurse for nothing.
Okay.
And she was amazing. Like, I loved her. Like, she put stuff in there, like, you could see where she was getting into with the claims examiner
Mm-hmm.
about things. All those notes are in there.
Good. Have you requested a copy of those?
It's all in my e-comp.
Okay. So then have you downloaded everything?
Yep.
Okay. Every time something goes in, you need to download it.
I have a book that shows pictures of me. I look way better than I did. You know, I have pictures before they found out that I had an immune deficiency. Like, I went from just being pale and green, and, you know, my eyes are black. They
Mhm.
stay this way, but it was awful. Like, my feet turned purple. I get sores in my mouth. My immune system's messed up. My joints are messed up. They don't know why yet.
Yet she has
All
to-
from COVID.
All from what happened. It was either cope, you know, like, I don't know. I don't know.
And these infusions, should let Kevin know how you have to administer those.
Yeah, in my stomach. I do infusions once a week on myself.
And how long does that have to sit in?
It takes about an hour and a half. I have an IV pump that I put in my stomach.
For an hour and a half.
Every day.
Once a week.
Once a week.
She has to carry something as it's being pushed into her. It takes an hour and a half for that to finally get into her system to help her.
Okay. Thank you for talking with us today. I will get you a copy of this.
I
before it
could
goes
go on and on.
anywhere.
I mean, there's so many things. I mean, this could be part one. I'm serious. It's been that bad.
We're going to get you a meeting with the medical center director or the visiting director next week.
Okay.
We'll make it happen pretty quick because you should not be dealing with this. This is no fault of your own.
No, it's not. And that's what I say all the time. I was like, I've never gotten so much trouble for something that was done to me. Like, I've lost everything. And I can't go start a new job because I can't go into it sick like this because I'll turn around and they'll fire me.
But why
know?
would you start a new job
Right.
if you have a job and the job you have caused you a workplace injury?
Correct. I don't know what to do. I don't know.
But your profession is a dental hygienist.
Yes.
You came here, you gave the agency that benefit. While you were giving them that benefit, you suffered a workplace injury here.
Correct.
And as a result of that, you are here now today, no fault of your own.
Yes.
Imagine being have an amazing work ethic at everything that you do. You try to be the best at it. Then have somebody demoralize you by saying, you're lying, you just don't want to work.
Yeah, Dr. Biershin
Imagine that.
literally told Dr. Dennis that they were going to maybe they needed to talk about giving the other hygienist a bonus for taking up my slack.
Wow.
Yeah. So imagine that. I was locking myself in my room. This is the person that's my supervisor.
Okay. Anything else you want us to know?
Well, thank you, first of all. Like I mentioned earlier about the Veterans Administration and the employees that look for that kind of work really care about the veterans. But when the people don't care about the people that are actually taking care of the veterans who are supposed to take care of the people who are taking care of the veterans,
That's correct.
it's very difficult to be a person, to get up every day and feel great about what you're going to do that day.
Mm-hmm.
I have to give a lot of credence to Kristy. You know, she fights through it as much as she can. She tries to get through it. The constant aching and pain is not easy. As we get older, we know how that feels. But imagine
We do.
imagine
We do.
But imagine having that 24/7 and not looking to say anything about work. I'm still going to work as hard as I can, but just reasonable accommodations because of something that I was concerned about, that you said it was okay. And because of that, you saying it okay was not okay. And I'm the one who has to suffer through it.
Yeah,
Why do I have to suffer twice?
And I'm sure that Ashley or no one involved in your case is losing pay like you are.
Oh no, they don't give a damn. None of them.
Now, I don't know how true this is, but if I can remember back that long, she was very concerned about taking that shot. I remember.
Yes.
She said to me, she says, they will fire me if I don't take this shot, get this shot by that date. I don't know if you recall that there was some issues.
There was?
Yeah, they were mandating it.
And do you realize that employees were given an exemption for not taking the COVID vaccine?
You know what I'm going to say is the reason I took it is because I would have never been able to live with myself if I had COVID and didn't know it and gave it to one of my patients they're all disabled.
Mm-hmm.
Dental is 100% disabled. So I had that in my mind, like, if I don't take this and something happens to them, I will never forgive myself. Ever. And that's why I took it. To protect them.
And now she's looking to be protected,
Okay.
just with that same thought.
Well, we're going to protect you.
I know.
Okay? We're going to help you. All right? And we're going to get the people involved here that can help fix this thing immediately.
Thank you.
Okay? All right, guys. Thank you for your time.
Yeah, thank you.
Appreciate it.
Kevin,
Yeah.
thank you.